Hello everyone. Today we are going to talk about the accurate way of blood pressure measurement and its importance in our daily practice. Hypertension is characterized by increased systemic arterial blood pressure and it's a major risk factor for stroke, myocardial infarction, vascular disease and chronic kidney disease. The relationship between blood pressure and cardiovascular and renal events is continuous, making the distinction between normal blood pressure and hypertension based on cutoff values somewhat arbitrary. However, in daily clinical practice, cutoff blood pressure values are used to simplify the diagnosis and decision making in the treatment and follow up of hypertensive patients. Epidemiological studies showed associations between blood pressure and cardiovascular risks extend from a very low level of blood pressure. However, hypertension is defined as the level of blood pressure at which the benefits of treatment outweigh the risks of treatment, as documented by clinical trials. According to the WHO, an estimated 1.13 billion people worldwide have hypertension, and most of these patients are living in low and middle income countries. In 2015, it was estimated that 1 out of 4 men and 1 out of 5 women had hypertension, and only less than one-fifth of the hypertension population have the problem under control. We usually learn blood pressure measurement early in the first years of medical school, but do we really know everything about it? And do we practice it the right way in our daily practice? That's what we are going to find out today. First of all, what should we pay attention to before taking blood pressure measurement? As we can see here in this beautiful slide, according to the recommendations of the American Heart Association, some precautions should be taken into account to avoid artificially high or low blood pressure readings. Firstly, the patient should be seated comfortably in a quiet environment for 5 minutes before taking the blood pressure measurement. Caffeine, alcohol, smoking, and exercise should be avoided before blood pressure measurement. Second, we have to use the standard bladder cuff for all the patients, but we have to use larger and smaller cuffs available for larger and thinner arms. And the cuff, of course, should be positioned at the level of the heart, and the back and the arm of the patient should be supported to avoid muscle contraction and isometric exercise dependent increases in blood pressure. The third precaution is that on the first visit, blood pressure should be measured on both arms using the arm with the higher reading, and two blood pressure measurements should be recorded 1 to 2 minutes apart. Fourth, we have to record both systolic and diastolic blood pressure and note the time of the recent blood pressure medication taken before measurement. The fifth precaution is that blood pressure should be recorded as the average of two blood pressure readings on two occasions. Finally, we have to provide the final blood pressure readings to the patient verbally and in writing. In this way, the accurate blood pressure measurement is completed. Uh, what are the blood pressure measurements that are frequently used in daily clinical practice? According to the 2018 European Society of Cardiology guidelines, they provided some of the most commonly used methods. The first one is conventional office blood pressure measurement. This method is the most commonly used to measure blood pressure because the equipment availability and the trained staff in the doctor's office. The ESC guidelines emphasize that three blood pressure measurements should be recorded 1 to 2 minutes apart, and additional measurements only if the first two readings differ by more than 10 millimeters of mercury. Blood pressure is recorded as the average of the last two blood pressure readings. Additional measurements should be performed in patients with unstable blood pressure values due to arrhythmias, such as in patients with atrial fibrillation, which is a very prevalent cardiovascular disease, in whom manual auscultatory methods should be used, as most automated devices have not been validated for hypertension measurement in patients with atrial fibrillation. When using auscultatory methods, use phase 1 and phase 5 Korotov sounds to identify systolic and diastolic blood pressure respectively, as shown in this slide. The beginning of phase 1 and the beginning of phase 5 are like the points where we diagnose systolic and diastolic blood pressure. Finally, measure blood pressure 1 minute and 3 minutes after standing from a seated position in all patients at first measurement to exclude orthostatic hypotension. The second method to measure blood pressure is the unattended office blood pressure measurement. There are some evidence suggesting that conventional office systolic blood pressure readings may be at least 5 to 15 millimeters higher than the systolic blood pressure levels obtained by unattended office blood pressure measurements. So, if the patient is seated alone and blood pressure measurement is taken, white coat effect can be reduced or eliminated. The third method is out-of-office blood pressure measurement. It includes home blood pressure monitoring and ambulatory blood pressure monitoring. Compared with office BP measurement, home blood pressure measurement values are usually lower, and the diagnostic threshold for hypertension using this method is greater than or equal to 135 over 85 millimeters of mercury. There is also evidence that patient self-monitoring may have a beneficial effect on medication adherence and blood pressure control. Ambulatory blood pressure monitoring values are also lower than office BP values. And the diagnostic threshold using this method, the diagnostic threshold for hypertension is greater than or equal to 130 over 80 millimeters of mercury over 24 hours. Finally, let's have a quick look at the criteria for hypertension diagnosis. Blood pressure is constantly changing and cannot be diagnosed based on a single pressure readings from a single visit, unless the patient's blood pressure is significantly increased. For instance, grade 3 hypertension, or there is obvious hypertension-related targeted organ damage. According to the European Society of Cardiology guidelines for hypertension, hypertension is defined as office systolic blood pressure greater than or equal to 140 millimeters of mercury and or diastolic blood pressure greater than or equal to 90 millimeters of mercury. This criteria is the most widely used criteria in daily practice. If ambulatory blood pressure measurement is used, then 24 hours average systolic blood pressure greater than or equal to 130 over 80 millimeters of mercury is diagnostic for blood pressure. During the day, the average is 135 over 85, and during the night, the average is 120 over 70 millimeters of mercury. If home systolic blood pressure measurement is used for the diagnosis, then the mean home systolic blood pressure greater than or equal to 135 over 85 millimeters of mercury is diagnostic for hypertension. To conclude what we have learned today, hypertensive patients are often asymptomatic, and most of them are found to have elevated blood pressure accidentally. Accurate early diagnosis and appropriate treatment of hypertension is important for the prevention of hypertension-related complications. So, as healthcare providers, accurate blood pressure measurement is one of the basic skills, is one of the most important skills that we all should master, because overestimating the patient's blood pressure may lead to inappropriate treatment, and underestimating it may cause failure in making the diagnosis and putting the patient at risk for cardiovascular and renal complications. That's it for today. Thank you.